when I was with my mom, okay, you're gonna get taller, you know, you're gonna be happy after that. Don't think of the pain or the time or anything. If you think always of the pain that you're having, it's not gonna help, it's gonna make it worse. You're gonna just make it like you're gonna feel too much on you. So think more of the goal, and I think you will be satisfied at the end. And don't think too much. I was thinking too much, by the way, at the first. I was like, how's gonna be the proportions? How I'm gonna handle the pain? What if there's a complication or something? I think like many patients think this way too. After I let it go and just trusted the process and did what I have to do for my, like what I have to do, like exercise or do walking more or like taking care of myself better, like different aspects, you know, because I take care of these stuffs and you guys took care of the other stuffs at the first, especially the first 2-3 months. So I think that was like the key point. I think you will be satisfied at the end.
So hello guys, welcome to our YouTube channel. I have a patient here from
Iraq.
Greetings to Iraq, by the way. We did the surgery when exactly?
I think 1 and 2 months ago, like 1 year and 2 months ago.
Okay,
It's been like, it's been 1 year.
Okay, approximately 1 year.
Yeah.
So you choose the LON on your femur.
Yeah.
Okay, what was your starting height and what is your current height?
Yeah, it was 151 or 150, and I lengthened 9 centimeters. So now I'm like 160, 159.
To be honest, how do you feel? I mean, what exactly changed in your life compared to before the surgery and now?
Yeah, it's been so satisfying. I've never thought that I will feel that better about myself. First, for example, I used to feel so short, but now I'm almost like average. I'm average here in Turkey especially, or like even taller than most of the girls, like, so it's quite good, like different person, you know, but in a good way, not in a bad way. So it's been a lot of change. I feel like more grown up, like I really grown. I feel like clothes also fits well, and I like more like to make different outfit that fits my height now than I used to before. Overall, I feel so good about myself. It's been really a good decision to make.
Do you regret anything?
No, I don't think. Because, first days after the surgery, it was a bit painful. It's like, oh, why did I took that decision? It's been so hard. But after that, like, especially when I did the removal, I was feeling so satisfied because it was like the result was worth it. Yeah, so even if the pain I don't remember that much, like it's gone, like it's just like a vague memory, it's not here even anymore. So the pain, for 3 months or like 2.5 months, even not 3 months, it was quite painful some days, not every day. I had days where I had no pain, literally like no pain. But then at the end, like the last week, it was a bit painful because like 9 centimeters, I'm like done. You know, psychologically mostly, because you always see like the fixators on your legs. It's been like a bit hard, you know. But after that, when you remove, it's all good, and especially after you start like walking well and like going upstairs, downstairs, so good.
You said about like the pain, right? So how can I imagine that, or how can patients or people there watching the video, how can you imagine the pain? It's like headache or teeth pain, or?
It's different. It's different types of pain. But mostly like muscle pain, you know? It's like someone stretching your muscles. Because it's really stretching, getting stretched. That's it, Bone pain, there is no bone pain, by the way. There is nerve pain, but that was like few days. I didn't have that much. Mostly muscle pain, like I don't know how to describe it, but it's like, you know, when you do too much exercises, like leg exercises, and you feel like I'm finished, like burnout. I was like a bit like a burnout. I had days where I had really no pain, and I had days where I had pain, but it was like resistible. It's not that big of a deal, you know, with painkillers, with stretching, with like a bit of, you know, psychologically, you know, improve, like, I mean, psychological support. That's what made it a bit like, you know, that what helped me in it mostly.
It's like mostly the discomfort what we have.
Discomfort, most discomfort. Like not being able to sit every time well. But I mean, it's worth it because if you had like this decision and you've been like longing for this for a long time and want to get like taller, but in the end you got that, you're like, the pain is not important anymore.
Yeah, that's true.
You just have to be careful.
Yes.
And keep it clean.
Also, you know, when you look at the mirror, so you will forget every pain, by the way, guys. I mean, I did it also 3 times.
Yeah, right.
And also, you know, people or patients who want to do the limb lengthening surgery is also asking me how painful is it. So, guys, the most important thing, as you said, this is not like a headache or teeth pain. It's not like a pain you will cry. It's mostly the discomfort. As you said, it's like you are doing a lot of exercises, and since a long time you was not in gym, and today you start with muscle pump, and tomorrow, you know, I say always, you are not able to move 100% because
it's like muscle soreness.
Yes, muscle, yes, exactly. And that's the same thing. And also, I don't know, for me was like that. I had also some skin pain a little bit because of the fixator.
Yeah, it's getting stretched too.
Yeah, the stretching pain.
Yeah. But that's some days, not every day.
Exactly, some days.
First days especially, I had this.
But I have to say also, we have some patients here. Really, I'm sometimes really jealous. Jealous because, you know, they say, Sedat, I never use medication. Is that normal? I never feel pain.
Yeah, depends on the person as well.
It's crazy, right?
Yeah. I think because I didn't have too much painkillers too. There is patient who's like taking painkillers constantly. That wasn't good either, because taking painkillers always like make you not immune very well to the pain. But when you let your body get immune to the pain, it gets recovered well by itself and you don't feel pain, like you become resistant to pain, which is good. But if you use painkillers too much, I think that's the problem, where like, I feel too much pain because you're using painkillers. You get used to painkillers and they're not working anymore. You have to take more. It's that the reason. Like.
I have a huge respect because you are already an expert, you know what I mean? Because your body is different for sure, but you are absolutely right. The problem is if you use painkiller too much, your body wants more. And the problem is, we say to this kind of things, pain management. And you will be not able to manage the pain anymore, and then you will have more pain than compared to a patient who's not using painkillers.
Yeah.
It's absolutely right.
Yeah.
So it's really different. That's the reason why the aftercare for the limb lengthening surgery is really huge important.
Yeah.
That's really good. Thank you for the information, because that's also important for people who want to do the limb lengthening surgery. Before I talking about the recovery and everything, so I have a question for you. So what do you think about that topic? Is the limb lengthening surgery something which is really necessary? Or I also see sometimes the comments like, this is a pressure from people. That's the reason why people want to do the limb lengthening surgery, because people feel under pressure, blah, 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 blah. So what do you think about that topic?
Well, my opinion is that the world is not perfect, right? We're not living in a world that can tolerate your appearance if it's not like fitted to the standards of the, that depend on the country as well. So most of the countries prefer like taller people, right? And especially if you're under like the average, it's very difficult. No matter how you try to be, especially like if you wanna, have huge achievements and like go universities and be like have business and stuff like that, you need some of the appearance. It's like important, especially to the charisma and stuff like that, right? So I don't think, it's necessary, but depends on the person as well. If you're like especially beyond like below average, I think it's good. They can do it. I recommend it. But it depends also on how psychologically they can, handle it. It's a bit psychologically demanding than physically. I mean, it's physically as well, but psychologically more. If you have someone that can support you, like a family member or something, like a friend, with you with the journey, it's good, it's better. But if you stay alone, I think it's a bit hard, because when I was with my mom, who's like the person who used to help me with that psychology, she's like, okay, you're gonna get taller, you're gonna be happy after that. Don't think of the pain or the time or anything. So I was like, okay, I was like a bit better than even the patient that were alone. So I really recommend whoever is gonna take it, have someone with you. Don't be like, do it alone. I think you have to think of the goal, because if you think always of the pain that you're having, it's not gonna help. It's gonna make it worse. You're gonna just make it like too much. It's gonna feel too much on you. So think more of the goal, and I think you will be satisfied at the end. And don't think too much. I was thinking too much, by the way, at the first. I was like, how's gonna be the proportions? How I'm gonna handle the pain?
My next question, by the way.
What if there's a complication or something? I think like many patients think this way too. After I let it go and just trusted the process and did what I have to do from my, like what I have to do, like exercise or do walking more or like taking care of myself better, like nutritionally and like different aspects, you know, because I take care of these stuffs and you guys took care of the other stuffs at the first, especially the first 2-3 months. So I think that was like the key point, you know, if you do what you have to do and not like overthink, you will be good. But yeah, patients who's like under average, I think yeah, I can recommend them to take. They will feel better. For me, myself, I felt so better, like so much better. Yeah.
You feel also the difference, right?
Yeah, it's a big difference. I can't lie. Like even the people around it, they perceive me differently now. They think more of like grown up, you know. Yeah, there's a lot of difference.
Also, the feminine body, it's more to shine, right?
Yeah.
So because with short height, I mean,
No.
also not the feminine body, also the of a man, the body, but
it's important for both.
Yeah,
And
it's for
I
both,
think it's important for. I mean, females don't need like to be above 170, of course. Above 160 is too much.
Yeah.
But till 170 is so good. Like 160 to 170, 165 to 170 is pretty good. But under 160 or like 155 and under, so can be like, I mean, depends also on the person.
It's also hard. I mean, guys, it's not only the appearance. Please correct me if I'm wrong. It's also hard in your daily life. For example, when you drive car or,
Yeah.
you know what I mean? It's not only this, guys. I mean, because, you know, what makes me so sad, sometimes people is really writing so hard,
About
not
themselves?
so good comments about limblengthening surgery.
Okay.
But guys, you know, the respect is the most important thing. I mean, the problem why wars and the negative things that happen is because of people is not respect each other. That's the most important point. So and we have to respect each other, guys. And also people have different problems. For example, patient from, you know, for example, a patient like he wanna grow up because of women's, to be honest, and the other because of his business, and the other because of the psychologically point.
Yeah.
And for another patient is like the daily life really hard. I mean, everybody has different problems, and also it's not only the limb lengthening. For example, you know, you already know that, but for example, people is coming for limb lengthening, but we corrected also the genu varum or genu valgus, for example, the ball legs and
That's
X
so
legs,
bad.
which is really important for the future, for the health condition. I mean, it's at the end the investment in your body self. Or people have discrepancy and different cases, you know what I mean?
Yeah.
Also proportion, it's another point, which I will ask you also. But before I ask you the proportion, you know, for example, 60 years ago, cloth, forget it. None man in the world, they wear some jeans or this kind of, you know what I mean? It was different, and now the time is also different, guys. And yeah, here's unfortunately appearance really important. To have a good nose, it's important. To have the perfect height is important, and because this is something with you in your daily life.
Yeah.
So, by the way, you are a beautiful woman. I have to say that. And what do you think about your proportion as a woman, and the most asked question, the scars?
The scars. So first, the proportion. That was like a bit, consuming my mind. So I thought about this at first. I know this is a bit like unproportioned, maybe because I thought this way because I know that I did the surgery as something like it's different than I used to. But after that, like after a couple of months, when my muscle started to grow and get back normal and everything started to, build itself, recover well, I started to notice that there is nothing like really. I was astonished for real. I was
Crazy.
like surprised.
Yeah.
If I didn't know that I had the surgery, I wouldn't know really. So I think it's good, and I think it's good that we lengthen from the legs, not the
Thanks to God.
if the torso would be like too much.
Then we can
Then
talk about the proportion.
proportions.
Yeah,
But the
problems.
legs looks good when they are taller in general. Yeah, longer. I mean, sorry.
Yeah.
So yeah, I think the proportions are good. And I lengthened 9 centimeters. I was afraid maybe I should have done 7 or 8, but I was like, no, stubborn. I want to do 9. When I did 9, I was like, maybe I will regret. Yeah, I thought 10, but then because it was a bit painful, so I was like, nah, let's stop at 9. But I think it's good. Even if I did 9, the proportion is still good. So yeah, I think the proportion first people, because I noticed this also in like in the photos on like social media. I've noticed because you guys were like taking the pictures just after the removal, like the fixator removal. And the fixator you can notice. But after that, the next removal, like this removal, nail removal, I think they will not, after like the muscle grown. Because at that time they start recovering, not yet. Yeah. After recovering well, no, I don't think. Even my mom, she was like looking at me and she noticed that it was all good. She didn't even, she was like, I wouldn't recognize if I wouldn't know that you had a surgery.
You know, the point is, for example, the proportion. Yeah, many people is asking that. I mean, I'm talking about the body, what you shine to outside. I mean, the appearance. So the proportion is not something we can damage it. As you said, torso lengthening, thanks to God, it's not possible. Yes, then we can talk about the proportion problem. But to reach 10 on the femur or 8 on the tibia, it looks naturally for sure. But of course, if you reach 20 centimeters, like 6-7 inches
Yeah,
from the
it's
femur,
too much.
then of course we can talk about, okay, your femur looks longer. But I think we will also check your before after. You will be you are happy then with your proportion than before, right?
Yeah.
Yeah.
Yeah,
So
yeah.
And it looks. I think I don't know. We will check the photos, but I don't know what do you think about it. But you look now more natural than before, I guess.
Yeah, true.
Yeah?
True.
Yeah.
Because I had short legs too, like in general. But like my torso was good and a bit like half feminine, like older. But the legs were a bit short, so when I lengthened the legs, it's like perfect for me. Yeah. So about the scars, about the scars is good. Actually, I didn't think they would recover well. Like, especially those the first like femur upper, the tibia one, like the near to the
Distal,
tibia, yeah, the knees. It's a bit like because it's deep.
Whole.
Yeah, it's a bit whole, and that's it. The other scars, there's no other scars. Yeah.
The whole. Dr. Halil will, of course, he will check and he will connect it.
Yeah,
Skin,
I heard
then
that.
it will be
Yeah,
straight.
that's good. Yeah, this that.
Yeah.
And the color, I don't know. I think the color is my skin color is getting similar to my skin color.
Exactly.
I think we can do like a laser or something.
Yes.
Later I will do something like
But
that.
I have to say
It's
also one
needed.
thing: it will be never healed 100% because
okay.
skin is unfortunately,
Yeah.
you know, it's not like bone.
Yeah.
But to 80%, I mean, you are. I think you are already happy.
Yeah, I'm
So,
happy. Just a bit from the knee side. That's it.
But after the scar removal, you will be definitely more happy.
Yeah, I think it's good. So I'm satisfied overall.
Okay, so thank you for the information. So then I have one more question because
course.
that's really important. This is the recovery point. So you know, people's is until now asking me, okay, people's getting tall, but they have to walking with, you know, like limping. They have to be limp forever, or like walk like a duck or penguin forever. I mean, people's really thinking like, okay, patient is going up, yeah, but unfortunately, he can never walk or run.
There's a compensation. For
Exactly.
It.
So please, can you tell about your story and can we talk about it? After the limblengthening surgery, can you really get recovered? And do you have any, except the nail removal, do you have any sign of changing like the same life as before?
Yeah.
You know, so this kind of things. Can you, what do you think about it?
Yeah, so first it starts hard. Yeah, because like after the fixator removal. So first you like a bit feel heavy, not heavy, you're like unbalanced, and like the muscle still weak. After like few months, you start to like the muscles start to heal and recover, and the bone start to heal better. So then you start to walk way better. So I started walking after 1 month of removal. I was start like a bit wobbly, like not too much even, like a bit wobbly. But I kept the walking. I kept the going upstairs and downstairs. So I kept that, and I was going outside, by the way, like without the what's called this yeah. So I was going by myself. It was all good, but with time it started to get better and better and better. So when I started to walk very normal, I think after 3 to 4 months, 3 months, not 4, start like walk normally, like no one would notice anything. Yeah, but and then the movement, I started, like to pray. When you pray, you do a lot of movements.
Yes, it's also another most asked question.
Yeah. So we do a lot of movements, like it's a bit like stretching.
Yeah.
So that was like yeah, 2 months after fixator removal.
Wow.
I was a bit like praying on the chair, but then I started praying normally.
Wow.
Yeah, and was actually better. It made it like better, like stretching exercise for myself.
Okay.
Yeah, I did stretching from time to time, but I wasn't consistent. That was
Okay.
like a bit
Typical, yeah.
laziness from me.
That's the reason why you needed 3 months for walk
Yeah,
normally.
yeah, a bit. So I think it's good. I mean, by normal, you walk normal, but after 3 months, you like completely normal, perfect normal. Like even not,
Limping
yeah, or something like that. So, and it's bit depends on the exercise and the stretching. The more you stretch, the more you exercise. But I was a bit lazy, so that was a downside from me, from my side, and that's it. But I think no, it's all completely normal. I can do a lot of movements and it's all okay. But now since I started to heal, like the bones like already healed, I start to feel like the what's called the screws.
Screws,
Yeah, and
They
that's
make me press.
a good sign, as you said. So I wasn't even worried. I thought like it's a good sign because the bone is healed, so I have to take it out now, and just heaviness, just a bit heaviness, and that's it. I don't feel anything.
What about
like,
sports?
Sports? I'm not a sport person. That's my problem. Yeah, but yeah, from time to time I play with my friends, brothers. I don't do like football, basketball. I'm not fan of these things, but like badminton and like not running, but volleyball, like handball, something like that. It's okay.
But you can do it everything as before, right?
Yeah, I can, but I'm just not into like jumping too much.
Okay.
Yeah, just jumping scares me a bit.
Okay, why?
That's it. I'm just
And you
scared.
say because of the nail.
Yeah, the
No,
nail.
she can. Please try, she can. So
Yeah,
we have a
yeah.
guarantee, by the way. If something happened, we have the video.
It's okay. No, I'm just I think
Yeah.
I'm a bit lazy and a bit like scared, because I feel the heaviness of the nails
Okay.
from time to time, and that's it. But I think I've seen patients like they jump right. Yeah, I was like, they're better than me, but what we can do? Because I didn't train myself. If I trained myself, I would do it better. I'm really like a bit lazy at that part. That's it.
But you have the same life as before without any restriction, right?
No, it's okay.
Perfect.
It's all good. Maybe you will restrict like if you are an athlete for 1 year, it would be a bit
Yeah,
like
for sure.
Yeah, I mean
sure.
we can't say something else.
But-
But other than that, after nail removal, I will feel better. I'm sure.
But it's also like, for example, imagine when I start to make gym, like to build my upper body.
Yeah.
I cannot build the muscle in 1 month.
Yeah, it
It's
takes
impossible,
time,
you know,
right?
It takes time. This is the
Yeah.
same procedure, guys. I mean, limblengthening surgery is like the real life, by the way. So it's not like, okay, you do the surgery and tomorrow you are 4 inches tall or 10 centimeter and then you can run away. It's not like that.
No, it needs
So,
a bit of patience, of course. And yeah, it depends on the person, the patient. If they are good, doing everything they've told of and not being too lazy, consistent, they will be. Because I did the walking and the going upstairs and downstairs so consistently, so I'm so good at it. I recovered well fast. But
amazing.
if I did I did stretching, but I didn't do exercise like, weightlifting or something. I did a bit of body weight exercises. It was all good. Yeah, I mean,
Awesome,
it
awesome.
can be done. It's not like a big of a deal. But I think I will feel way better after the nail removal. I feel like, the bit of the heaviness will go and that's it. We will all be good. Because when you train with the nail, it's like you holding weight on like you holding weight dumbbells already.
Yeah.
And especially if you're a beginner, you're like, that's too much. That's why, yeah. But I think people who's like trained well, they have already like good muscles, they'll be already okay with training. But I'm a bit like, women is different. Women muscles not that as strong as men's. So that was a bit difficult for me. Other than that, I think it's all good.
So, but I will ask something.
Ask.
I think I never asked this question. You are the first person. Because we was talking about the pain and, so only negative things. So just positive, what was your best moment in limblengthening surgery?
I think after 5 centimeters.
Wow.
Yeah,
Okay.
the noticeable change was so good. I felt like I'm seeing a real result, Yeah, I think that was the best moment. And I was like, okay, let's trust the process. We go like that. We go ahead like that. It's okay.
it's really crazy because as a child, you cannot notice, you cannot see, you know, it's something which is of course that you are getting taught, but to learn, I mean, our patients said it from United States, to learn that height, you know, to see that you are growing up every day and you are not a child anymore. So it's really, it's an amazing feeling.
Yeah, it's different when you grow, like normally grow.
Yeah.
You don't notice they change too much. People notice they change in you, but you don't notice. In this one, it's different. You notice they change before people. So you're like, oh, already I'm gaining like heights and so good.
It's crazy.
Yeah, it is.
So do you recommend this surgery to people who is really suffering from height?
Of course.
Yeah?
They will feel way better. Your self-esteem will be so good. Like you will feel good about yourself and you will not think of the height anymore. Like it will be gone completely from your head, especially if it's like something you've been struggling psychologically with it for a long time. I think these are the most important people. They need to do it, but they need also to understand the, not like the demandings of the surgery, like psychologically, physically, it's a bit demanding. We can like, you know, it's demanding, but you can have, like, you have to acknowledge that these things will be like the cost of your height, you know, but after that you will feel good. You just have to be like, take full responsibility of yourself. Be so serious about yourself. It's not like an easy thing. It's a hard thing. It will be so easy after the result. What I mean by hard, if I can do it, I could have do it, anybody can do it. It's not like a big deal. Well, I swear it's not big.
What you can say about Livelifetaller?
It made my dream come true, which is the best thing. I've been thinking of that. That was like impossible, you know? The first time I learned about like limb lengthening was like a couple of years ago, and it was like, I was like searching, but not that too much information. They said it's like necessary for people who suffer disabilities, right? So then I was like disappointed and I was already giving up. And then because my age was a bit like young, so I was like, maybe we can go do hormonal therapy, you know, like growth hormone, because my brother did take growth hormone and he grew it.
Okay.
Yeah,
really?
yeah. So I was like, maybe I can do the same thing. But when I went, they said like your bone, you know, it was fused. Yeah, it was fused already. And so I was like, there is no solution. That's it. Okay. You have to accept it, you know. But I couldn't accept it. And it was like, I thought there is like a solution, but I didn't know really. So I was searching constantly and stuff. And then I found that they do it in Turkey. And I'm living in Turkey. Okay. It's like way too good for me. It's like easy access, you know, and I can come and, you know, communicate well. So I was so happy. And when I did it and everything happened smoothly, which is I'm grateful for. So I think, it's a good, like, you can do the surgery here. It's all good. You just have to do your, like, as a patient, 50% you, 50% Livelifetaller, and that's it. You have to do your part, of course.
That's it.
Yeah.
Thank you very much. I really appreciate it. Thank you
too.
For the whole information. Thank you that you share your story with us. Believe me, that will make a lot of hope to other people.
Yeah, of course.
Especially women also.
Yeah, I recommend women do it. I don't see a lot of women do it, which is like surprising because I think women can handle pain more than men. They can do it. Like
yes,
quicker.
but I have to say something here. We have a lot of women. But
start.
Unfortunately, nobody wants to do the video.
Yeah.
You know why? Because if you ask a woman, like, I'm natural. I never did surgery. It's
it's true.
always the same. You know, yeah.
We differently confident. I'm gonna show it.
Which I respect, of course. I mean, my wife would also never do a video. I'm really open for that.
I know.
You know, I say I did my nose. I'm now fake. You know, I say always that. Yeah. But I mean, I'm happy with myself.
Yeah. I'm open about this too. And if I'm not telling everybody like, oh, come, you know, I'm did a surgery or something like that. But if they know, it's okay. It's not like a big deal. Like it's I don't think they're doing like, you know, nose, everything. They're doing everything now, which is like also necessary. But I think height is the most necessary thing if you're really short, you know. because that's what you see first. Like when you see a person, you look at their heart, like at their whole
The first
body.
impression.
Yeah, it's like first height, next like your weight, right?
Exactly.
Yeah, so
The
it's
face
like
then.
a bit, yeah, then face. So it's not prioritized well. It should be prioritized well. Like people should think, oh, if they have a height problem, I think they would go for the height problem first than anything. Because height, you can, sorry, but you can see not very attractive people like as a face, but they have like too tall and you'll be like too attracted to them. So yeah, height is a bit important.
The craziest thing is, the height confirmed the face.
Yeah.
And then the weight. Because if the first impression, wow, he's tall or she's tall, okay, now I can look at your face, you know what I mean? So that's really crazy, but unfortunately it's like that. So because we are at the end a human, of course, for us it's also some things important. But anyway, thank you very much. I really appreciate it. Thank you that you share your story. And guys, as I said, I mean, this is not only, here is not people's like crazy or not normal how people can do the limb lengthening surgery, or also people's not doing that for men or for girls. I mean, you are the person, like you are every day with yourself and you look at the mirror. I mean, that's the most important point. To invest in yourself
yeah.
is really better than to invest in a car or house, because you are all the time, you are the person who earns money, you are the person who drives the car, you know what I mean?
Yeah.
So, and that's the most important. It doesn't matter height, nose, or some other things. And just please respect these people, because this is not only a few inches or centimeters, it's a whole life changing.
It's a big deal.
Yeah. For example, when I did also the surgery, my wife, she said, you know what? You feel better and I feel also better.
Right?
You know what I mean?
Same with my family, like my mom and
Yeah.
my brother as well.
Yeah.
It was like, you feel good, so I feel good too.
Yeah.
Like people take your own energy, like so
Exactly.
it's good. Nah, invest in yourself. If you feel good about
Yeah.
yourself, you will do good things. So the
Exactly.
car will come, it's okay. The money will come. It's not like a big deal. These things comes, but like the height, this is one time, you do it and that's it.
Yeah.
So you have to do it. Like it's so important. If you really think it's like a big point for you, you have to do it. You will feel way better about yourself.
As long as you're happy with yourself and that's the most, then you are also successful,
Yeah,
but of course,
true.
right? I mean,
Affects you psychologically.
exactly. For example, before I was with my wife the same height, and we was on the photos also looking like each other. Now she can put her head on my chest.
Yeah,
I'm told this is, for example, something which she said, okay, you did the surgery, you growing up, but I have also something about
Yeah,
it.
yeah,
I
true.
feel more confidence.
Yeah, true. Especially for men, this way. Yeah.
Exactly, but for women also it's the
True.
same. Yeah.
For women, if it's she, I've seen a lot like 150,
Yeah.
like 150 centimeters women, and the guy's like 180 or like 190
Yeah.
even. I've seen like she looks like a baby to him, like
Exactly.
like a kid. I mean, child. Sorry, not baby. So it's not that good. I don't think even they feel good about themselves.
Yeah.
They should be like a bit like 160 to 170 is good. Like a bit, how can I say, well put with the man,
Yeah.
Yeah, so I think no women. I would recommend to everybody in like my university. I've seen a lot of short girls, but I'm afraid to go and tell her like, oh, go do surgery or something,
Yeah,
because she will take it offensively. But I really like want to go and tell them, because I feel like they're a bit short,
You feel sad for
Yeah,
them, right?
sad for
Me
them.
too, by the way. So, and guys, to be honest, I mean, if you can change something, do it. I mean, it's never too late. It doesn't matter. Is that your bad character maybe? You can change it, or your height, or some other things which makes you happy. But do not, please, give some hard commentaries for peoples, because, everybody have different goals and dreams and stories also. This makes me really sad, because I feel it, I did it, and I had the same things. Anyway, thank you very much. And I also will say thank you to your mother, by the way. She helped you a lot. Your brother also, but especially your mother.
Yeah, she did.
She was your friend, she
Yeah.
was your sister, everything, not only
she
mother.
was everything.
She's really amazing.
She was massaging my legs when I had like
Yes,
pain.
exactly. I
My
wish you the best.
physiotherapist.
Yeah, that's true. External visits, right?
Yeah.
And also
Fair
I have to say thank you to the whole team, first of all Dr. Halil, and also to all our physiotherapists and the whole Livelifetaller team. So thank you very much. Thank you for your trust. And now we will also see, is that true? Can she walk? Can she run? And please, she should jump also.
I will try.
To see, you will see that our nail is stable.
I tried.
Let's make a quality test, you know?
Yeah, we can.
Guys, thank you for watching this video. Greetings from wonderful Istanbul. Take care. See you in the next video.
They call me a